Brain drain has a devastating impact on healthcare service delivery in Nigeria, given that across the country hospitals are overstretched and many clinics are left without specialists, not because the professionals do not exist, but because they have left the country for a greener pasture. According to recent reports, Nigeria has lost over 30% of its medical doctors to foreign countries in the past decade, with Nigeria Medical Association (NMA) estimation that the country needs at least 200,000 doctors to meet the healthcare needs of its population, as currently there are only about 70,000 doctors available.
About 4,000 doctors are leaving the country every year. And currently, according to the WHO standard, we should have one doctor attending to 600 people. But here in Nigeria, we have one doctor attending to about 8,000 to 10,000 patients, which this is causing a lot of workload, more call hours, you don't have much time for your family, you are not well valued, so that is why most people decide to be leaving.
Nurses and midwives have also been affected, with over 42,000 requesting verification to practice abroad between 2017 till date, according to the Nursing and Midwifery Council of Nigeria.
Out of the over 42,000 that have applied, virtually as of last month, the record shown that over 18,000 applications were processed and these people have left, and so many also are on the queue.
These shortages is further exacerbated by the brain drain, which has seen many medical professionals leave the country in search of better opportunities.
In the year 2024, last year, we had 4,193 doctors who have requested for certificate of good standing from the Medical and Dental Council of Nigeria, which means that they want to JAPA. If you compare that with the number of doctors that have been registered, inducted newly by the Medical Dental Council, it was 4,900. Yes, is slightly higher than the those who have left or are leaving. Some of them are seeking greener pastures because of better pay. Certainly that is true, but don't forget, when you get there, you will have to spend either pounds sterling or US dollars to keep yourself above water.
In Borno State, where insurgency has compounded medical challenges, the government took a bold step by introducing special incentives for doctors and health workers to attract and retain them in the state.
Borno State government, like any other state in Nigeria, is making preparations to ensure that the staff that are recruited are maintained so that they don't JAPA, if I can use the word. Borno State is possibly the only state in Nigeria that pays 30% extra salary for those who happen to be serving in rural areas. And in full preparation of this JAPA syndrome, Borno has built a university teaching hospital, which will be commissioned very soon, and there's also medical school, which doctors will train, and nurses, midwives, pharmacists. Borno has actually built 2 nursing colleges or schools, one in senatorial district. In the southern part of the state is in Goza, and in the northern part is in Monguno, and we already have one in Maiduguri, which is the central, and we have increased the number of graduates from 50 to 150 to now 600 per year.
The Borno State government, they provide houses for their doctors. They provide the BOCHMA, which covers for the healthcare services. It's an insurance scheme for doctors. There is a medical training fund that the Borno State government is giving so that young doctors can train and become specialists. The federal government pays about $1 million annually. This Borno State government also pays this exact amount. Just this year, the Borno State government has also increased the allowances to be exactly as that of the federal government, which we don't see in most states. Currently, they receive more than those that are working in the federal government.
The state government is trying its own best by seeing how maybe putting those infrastructures in place that will be conducive for this thing for work, and other equipment that you need to use.
Although some state governments are responding to bridging the gap, just as federal government launched several policies, including engaging retired consultants to mentor young doctors. The NHIS now supports telemedicine in remote areas, reducing pressure on fiscal personnel, while National Assembly, on the other hand, is debating a bill mandating doctors to serve for 5 years before qualifying for immigration.
The way forward may be working out a system where if, let's say, United Kingdom wants 100 doctors in Nigeria, then it has to work out with Nigeria so that they will pay for the training of, let's say, 300 doctors.
Improving the condition of service, including nurses in the decision making at the federal institution, creation of department of nursing at the Federal Ministry of Health, and other things that will give nursing autonomy of their own practice as professionals. So those demands, if the government can look into, there are about 9 basic demands that if the government can look into in that ultimatum, then definitely it will address some of these.
If other state government can emulate what Borno state government has done, I believe a lot of people will stay.
By retaining medical professionals and improving healthcare services, Nigeria can reduce the economic burden of brain drain and promote better health outcomes for its citizens. If Borno, in the midst of security challenges, can start turning the tide, then surely the rest of Nigeria can do even more. In Maiduguri, Pauline Kujevan reporting for Deadline 360.